The ideal candidate for upper airway stimulation meets 4 criteria. The first criteria is patients have to have moderate to severe obstructive sleep apnea. The second criteria is patients have to be not tolerating their CPAP. This device, unfortunately, does not work quite as well as CPAP. The third criteria is the BMI or body mass index. The BMI should be less than 32. However, some patients with a higher BMI may still qualify for this implant. And the last criteria is the airway anatomy collapse when a patient is sleeping or sedated. And this is evaluated through a procedure called a drug-induced sleep endoscopy, or a DISE exam, a DISE. This is an upper airway endoscopy performed when a patient is sedated with an IV sedative, and we evaluate the airway anatomy collapse. Ideally, we want to see an anterior to posterior or front to back collapse in the throat, and we don't want to see a circumferential or a concentric collapse like a camera shutter. Candidates that meet this criteria would be best suited for upper airway stimulation therapy. The upper airway stimulator is a device that we place in your chest, and very much like a cardiac pacemaker, this sends stimulation to your tongue. So some people call it a pacemaker for your tongue, but it has no direct effect on the heart. Upper airway stimulation therapy is typically done as an outpatient surgery, which means you go home the same day. The surgery itself takes anywhere between 2 to 3 hours, and there are 3 incisions made, one underneath the chin on the right side, one underneath the collarbone, and one underneath the ribs or underneath the armpit, all on the right side. A small pacemaker is placed in the right upper chest. An electrode is tunneled underneath the neck skin, and it leads to the incision made underneath the chin. Through this incision, we find the nerve that controls your tongue, and once we identify the branches of the nerve that we want to stimulate, we can put the electrode cuff around these branches. Now, the third incision is made underneath your armpit between your ribs, and through this incision, a sensing electrode is placed against your chest wall. That sensing electrode will sense when you're breathing, and that electrode is also tunneled underneath the chest skin and attached to the pacemaker. At nighttime, when you go to sleep, you turn on the pacemaker with an external remote control through the skin. Once the implant is on, there's typically a delay period that's set for about 30 minutes, and this period of time allows you to fall asleep before the implant kicks in. Once this delay period has expired, every time that sensing electrode senses that you're breathing, it will tell the pacemaker to send a small level of electrical stimulation to the tongue to make the tongue contract, thereby opening up the airway. When you wake up in the morning, you turn it off with that same remote control. If you get up to use the restroom, there's a snooze or a pause feature on the remote control that can pause it for about 15 minutes, but all these time points can be adjustable. Upper airway stimulation therapy has been a great option for many patients who have for years been struggling with their CPAP use. Some patients don't even use their CPAP anymore, and it's sitting in the closet collecting dust. Other patients have tried a variety of surgical procedures aimed at dilating and opening up the airway with little to no success. So for many patients, this has really been the first option in over 3 or 4 decades that has been very successful at fixing and curing their sleep apnea. The upper airway stimulator is completely implantable. Everything is underneath the skin and part of your body. It works with you. It stimulates on demand when you're breathing. It helps patients that snore. Snoring is usually a sign of sleep apnea, and by dilating the airway, it typically will address the snoring issue as well. If you think you might be a candidate for upper airway stimulator therapy and are interested, please call our office to schedule a consultation appointment. If you have any of your old sleep records or sleep study results that are not with Ohio State University, please bring those along as well.